Imagine a classroom full of empty desks, not because it's summer break, but because over 150 students are forced to stay home, quarantined after being exposed to measles. This isn't a scene from a century ago. It's happening right now in South Carolina, where 153 unvaccinated students are in isolation following a measles outbreak at 2 schools. But here's where it gets controversial. While health officials stress the importance of vaccination, declining immunization rates across the U.S. are leaving communities vulnerable to preventable diseases. Could this be a wake-up call, or is it just the tip of the iceberg? On October 13, 2025, local health officials confirmed that students from Spartanburg County's Global Academy and Fair Forest Elementary School were exposed to measles, a highly contagious virus that can linger in the air for up to 2 hours after an infected person leaves. These students, lacking immunity due to their unvaccinated status, are now excluded from school until the risk of transmission passes. The schools are working closely with the South Carolina Department of Public Health to implement safety measures. But the situation raises urgent questions about public health priorities. And this is the part most people miss. This isn't an isolated incident. South Carolina's outbreak is part of a larger alarming trend. The state has recorded its 11th measles case this year, with 8 cases emerging since September 25th. Health officials warn of active, unrecognized community transmission in the upstate region, where immunity rates hover around just 90%, far below the 95% threshold needed for herd immunity. Without this protective barrier, the virus spreads unchecked, putting everyone at risk, especially the unvaccinated. Measles isn't just a harmless childhood illness. It can cause severe complications, including lung and brain infections, leading to cognitive issues, deafness, or even death. Yet, the measles vaccine, administered as part of the MNR measles, mumps, rubella shot, is safe, effective, and widely available. So why are vaccination rates declining? CDC data reveals a troubling drop. From 95.2% of kindergartners vaccinated in the 2019 to 2020 school year to just 92.7% in 2023 to 2024. Is this a matter of misinformation, mistrust, or something else entirely? Take Minnesota, for example, where 2 new measles cases were reported this week, bringing the state's total to 20 for the year. 18 of those cases are children, all unvaccinated. Or consider the outbreak in West Texas earlier this year, which led to the deaths of 2 children and marked the highest number of U.S. measles cases in over 30 years. These aren't just statistics. They're stark reminders of the consequences of declining vaccination rates. Here's the bold truth. Vaccines aren't just about individual protection. They're about safeguarding entire communities. When immunization rates fall below 95%, herd immunity collapses, leaving the vulnerable, infants, the immunocompromised, and those who can't be vaccinated at grave risk. So, what's stopping us from reaching that critical threshold? Is it vaccine hesitancy, access issues, or a lack of public awareness? And more importantly, what can we do to reverse this trend? As the debate over vaccines continues to divide opinions, one thing is clear. The stakes have never been higher. What do you think? Are declining vaccination rates a personal choice or a public health crisis? Let's start the conversation, because the next outbreak could be closer than you think.